Hi, everyone. My name is Hannah Wendt. I'm the Director of Operations here at True Diagnostic, and we are back to you live with a new Q&A session. I'm really excited about the guest we have on today. His name is Dr. Fuhrman, and his lectures are life-changing. When it comes to health and nutrition, plenty of experts will tell us what we want to hear, and Dr. Fuhrman stands apart because he tells us what we need to understand. His seminars, lectures, and presentations are lively, fascinating, firmly grounded in the science of nutrition, and best of all, they are easy to follow. He gives clear guidelines for preventing and reversing diseases and extending our longevity, and who wouldn't want that? He's a dynamic speaker with over 25 years of experience. He's a world-renowned nutritional expert who has created the Nutritarian diet, which we will obviously discuss here later. And he's a prolific author and leader with over 3 million books sold. He is recognized as one of the foremost voices in the nutritional research space, and he is on the faculty of NAU Northern Arizona University Health Science Division and also serves as president of the Nutritional Research Foundation. Thank you so much for joining us, Dr. Fuhrman. I'm excited to hop right into it.
Me too. Great to be here.
Yeah, and I know I gave, a 30,000-foot overview of all of the work you have done in your career, but can you just give us a little bit of background on yourself and the work that you've done in your past so far?
Well, I was in the world figure skating team in the 1970s.
Yeah, something I did not know about you.
And I was a pair skater with my sister. And then I went to medical school with a specific intent of being a physician specializing in nutrition. So I went to the University of Pennsylvania School of Medicine, graduated in 1988. And it's been a very, you could say, rewarding, and I'm really always very passionate about what I do because I've always known that nutritional excellence was so powerful in enabling people to recover from serious illnesses like rheumatoid arthritis, headaches, asthma, psoriasis, reverse heart disease, get off your diabetes drugs and get rid of your diabetes, reverse blockages in your heart. In other words, nutrition gives the physician and the person the power to really, the tools to control the person's health destiny and reverse disease and get them off drugs. And so too much, there's an overall tremendous dependency on medications, which probably we learn are toxic and they actually can increase your risk of cancer down the road from being all these medications. But medications, everybody knows, has significant side effects and deal with adjusting symptoms, not dealing with cause. Nutrition isn't 100% of the cause, but it's like 90% of the cause. But in any case, so I pursued this, I'm a board-certified family physician with a specializing in nutritional science and nutritional medicine. So I pursued that as a career my whole life and have treated, tens of thousands of patients and families and enabled people not just to lose weight, but also to reverse serious illnesses. And then I have a retreat in San Diego where people who are overweight with food addiction, with medical challenges, instead of coming to a doctor for an hour, they can come here and stay a few months so I can feed them healthfully, train not just their body, but their mind, and give them the skills they need to eat healthfully and to love eating this way, with cooking classes, exercise, emotional eating, and also to me to take care of their medical needs so I can wean them off their medications. Deprescribing is a medical specialty in itself of how to take people gradually off medications as they become healthier. So I'm really still thrilled at doing this, and I just enjoy it very much.
Absolutely. No, I appreciate that background. And yeah, especially, you're very unique in the fact that you want to use more of a diet-based approach rather than, the medications or even the interventions. So can you tell us a little bit about that Nutritarian diet? What is it? What does it contain? Just give us the ins and outs of that particular diet.
Right. Like, what if you were going to put together a list of the foods that have the most scientific evidence in the science for increasing longevity and preventing cancer? Let's make a list of those 10 or 20 foods, what have the most powerful anti-cancer effects. And then once we put that list down of the foods that have the most powerful anti-cancer effects, then what if we made a dietary portfolio and designed it to taste great that would include all those foods? And then what would the outcome be? In other words, I have this acronym GBOMS, which stands for greens, beans, onions, mushrooms, berries, and seeds. greens, beans, onions, mushrooms, berries, and seeds, because that combination of foods have the most scientific support for extending human lifespan. If we can throw a dart at any of those things like mushrooms and just study them for a second, we can see that our body is designed to utilize the ingredients as mushrooms to protect the DNA and to improve immune function and to build the good digestive function and to host the growth of good bacteria in the gut and to suppress the aromatase enzyme that produces too much estrogen and have anti-angiogenic effects and anti-fat storage effects and anti-diabetic effects. So, for example, a study on eating just 10 grams of mushrooms a day in women, just 10 grams the size of your thumb, showed that those women eating that mushroom every day had a 64% lower risk of developing cancer. And we can do the same thing with onions. Onions show between a 50 and 88% in reducing cancer incidence in people eating more than a quarter cup a day. And so, so a Nutritarian diet is based on the foundational principle that the most proven methodology to slow aging is moderate caloric restriction in the context of micronutrient excellence. So we're achieving micronutrient excellence by having a wide variety of colorful plants and also making sure there are no particular nutrients that we're missing that could be valuable for human sustenance and lifespan. And then such as zinc or DHA, we're adding some conservative supplements for what these plant foods may be not having the optimal amount. So once and I'm saying here that achieving comprehensive micronutrient adequacy then naturally suppresses your appetite. So you're not desiring as much calories anymore. You're desiring the right amount of calories instinctually, and you no longer feel the need to overeat. And inherently what I'm saying here that overeating behavior and food addiction develops due to nutritional deficiencies, fiber deficiencies, and making the wrong food choices. And we get people making the right food choices, they can then control their appetite because they don't want to overeat anymore because the stomach's getting filled with fiber, with nutrients, and the apostat in the hypothalamus is controlled as well. The appetite in the stomach and the apostat in the hypothalamus are both controlled, making people satisfied, so they don't have to eat to the point of obesity, or of overweightness or obesity.
Sure, absolutely. Thank you for that answer. And thinking back about my own personal diet as well, I put even mushrooms and onions in my eggs in the morning, and now I'm going to incorporate them a lot more because this stuff is definitely scientifically backed and based, right? So besides the anti-cancer effects, what are some other benefits of this diet that your work has shown to date? Can you just talk a little bit more maybe about some other properties? I don't know, maybe it's anti-inflammatory in addition to the anti-cancer ones?
Well, one of the main benefits is compared to another type of diet or a standard American diet, first of all. People build up metabolic waste in their tissues. So we're exposed to two types of waste products that age us. One type is called endogenous wastes, which means they're produced by the own body as the byproduct of living and eating. Our body produces reactive oxygen species, it produces advanced glycation end products, it produces lipofuscin, ammonia, urea, uric acid. The body produces toxins that have to be eliminated and excreted. And then we're exposed to exogenous wastes. And exogenous wastes are toxins from the external world. We can smoke them in, we can inhale them, we can get them in food, we can take in nitrosamino compounds or polyaromatic hydrocarbons. So we in the body, we have a buildup of different types of waste products that age us, and as they accumulate, they cause cellular damage, they increase methylation defects, and they eventually can gradually increase your risk of cell death and cancer. They shorten telomeres. So what you're saying that the science here is that this is kind of unique, and I've published studies on this, that when people don't eat food, after digestion stops and they finish digesting the meal, the liver and the kidney and other parts of the body can more effectively deal with the backlog of metabolic wastes and of waste products in general. And the person who has a high level of waste in their tissues will start to feel shaky and uncomfortable and fatigued and cramping and headachy. They'll feel ill or unwell when their body's not digesting. And they're forced to eat again to stop the detox process. So now they're going from one eating occasion to another eating occasion, and they can't live comfortably in the catabolic phase of the digestive cycle when they're not eating. And I'm saying that when you focus your diet on natural plants that are full of antioxidants and phytochemicals, and you stop taking in so much processed foods and animal products, which produce more metabolic wastes. And we can discuss that in a minute. Then when you hit the catabolic phase of the digestive cycle, you don't feel ill. You don't feel like you have to eat. You feel nothing until the point where your glycogen stores run down, and then you feel true hunger. And true hunger is a different sensation than what I call toxic hunger, which is really a withdrawal symptom from an unhealthy diet. So I'm saying something, the additional thing I'm saying here is that most people feel withdrawal from their unhealthy diet, and those withdrawal symptoms force them to overeat calories to feel better. And they mistakenly think that feeling better is good, and really, feeling better is getting worse. Feeling worse is getting better. Feeling bad is when your body's circulating toxins and mobilizing. And if you look up the word inflammation in a medical pathology text, and Robinson Cochrane textbook is the one most medical students read, it'll say that the inflammatory process is intertwined with the process of repair, and inflammation serves to wall off and remove the injurious agent and sets into motion a series of events that attempts to heal and reconstitute damaged tissue. Our body, the point of that sentence read from that book, which I memorized, is that the body is this miraculous self-healing machine. But sometimes the headache is the healing mechanism in action. And taking a drug to push the headache back in the body, to stop the headache from happening, is stopping the detoxification and then making headaches occur on a more severe or more regular basis. The drugs that prevent the headache is the solution. And if we could get the body to a cleaner state, allow the toxins to come out, then you'll stop itching, your skin will clear, you'll stop having headaches, you'll stop feeling fatigue. And then ultimately, people get well from serious illnesses, including lupus and multiple sclerosis and rheumatoid arthritis and psoriasis. So all these exciting people who've made complete recoveries from serious illnesses by moving their body to a different level of health. And I'm also suggesting that fat on the body, that there's no such thing as an overweight healthy person. And the reason we say moderate caloric restriction is because body fat secretes toxic compounds like lipokines and cytokines. And body fat you produce more free radicals. Body fat activates aromatase, making you have excess estrogen. Body fat makes you insulin resistant, and then you have higher levels of insulin and higher, which then have proangiogenesis properties, which allow cancer cells to replicate. So we're saying that that having a high nutrient density of your diet corresponds with then having a high nutrient density in your tissues, a low level of toxicity in your tissues, and put together your instinctual desire for the right amount of calories to maintain an ideal weight, at the perfect weight that maintains muscle mass, but not extra fat growth.
Gotcha, yeah. And thank you for that explanation, Dr. Fuhrman. I'm sure you would agree then with the statement as well that food is medicine. Would that be correct?
I think we could call this program Food as Medicine. So yes, that's exactly correct. But food is the best medicine, and that's I spend most of my career taking people off their medication. So I always say, I'm giving you this promise that you never have to have a heart attack and a stroke if you follow my guidance. And I'm saying that you achieve that promise only if you achieve the normal weight, if you eat to achieve a normal weight. You don't get that promise if you're overweight. And you're not a Nutritarian unless you're either at a perfect weight, which means you're not too thin and you're not too heavy. You have your BMI is between like 18.5 and 22. So you're at a healthy weight, and you have a normal blood pressure with no medication, a normal cholesterol with no medication, a normal blood glucose with no medication. If you're requiring medications to control your blood pressure, you don't have a normal blood pressure. If you're trying medication to control your blood glucose, you don't have a normal glucose. So a Nutritarian who's protected is because they have normal parameters without the need for medication. And the more medications you're on, the more higher your risk of death. But in any case, you're also a Nutritarian if you're overweight and following the program and you're losing weight at least 1 kilogram a week. If you're not losing 1 kilogram a week and you're significantly overweight, then you're not following the program properly. So it's about 2 pounds a week, 1 pound every 3 days, and Nutritarians are either moving in the direction of the normal weight or they're at their normal weight. And when you're moving in the direction of your overweight, as you're overweight, even though you're not all the way at your most favorable weight yet, you still see biological parameters start to repair themselves. The insulin resistance goes down. People having lap band or gastric bypass, their glucose, their insulin resistance decreases as they're losing weight. Their diabetes might go away in the first month, even when they still have 50 more pounds to lose. Their estrogen levels start to drop. The inflammatory markers go down. And the angiogenesis promotion improves. All these parameters start to improve when the person is eating right and losing weight, moving in the direction of excellent health. You don't just see the result at the very end of that weight loss. You see it all the way. And if they start to go off and go up to regain, you start to see the problems start to come back again as the weight is traveling up. You see improvement as the weight is traveling down, or as worsening as the weight is traveling up. And that's why most heart attacks occur around Christmas and New Year's, when people come back on vacations and binge in holidays and the rapid regain of weight is a factor that increases risk of platelet coagulability and inflammation in the endothelial lining of the blood vessels, and puts down more juvenile plaque. In other words, the juvenile plaque is young plaque, and young plaque that's more laden with fat and more cholesterol and hasn't been invaded with scar tissue, smooth muscle and calcified. It's the young plaque that is more risky to cause a heart attack than plaque that's been there for 10 years.
Sure. Understood. Yeah, definitely important to keep in mind as, hopefully we'll get this video out before the holidays, but we have Thanksgiving already coming up next week and then Christmas in about a month. So everyone needs to remember that and think before they start to indulge a little bit.
That shouldn't be one 10-day self-destructive and gain 10 pounds in 10 days. Obviously, that's
exactly.
Not really,
Yeah, Dr. Fuhrman, the entire reason that we set up this call is because, of course, you're working with us. You're working with True Diagnostic. You have a study that is currently going on looking at the methylation patterns in this specific diet. And, really want to spend the last part of the call here talking about that. How did you hear about methylation clocks? Why do you think this is going to show a positive result with with your diet?
Right. That's the thing, is that what we're seeing is that people's health transformations are radical when they achieve nutritional excellence. It's really radical. And we see it, their blood pressure normalizes, their vascular elasticity improves, their blood pressure goes down. And we know that these markers of aging, and I'm making this radical claim, this is so radical in the field of nutritional science to say that people can actually age backwards. That we can actually take these markers of aging that True Diagnostic has developed that can show increased risk of propensity towards cancer and can make measured parameters of aging, and say that in the same individual, when this on a poor diet switches to a good diet, we're trying to show that in a period of months or years that they see their aging at a lower biological age than they were when they were younger. And number two, when we take people that have adopted healthy living practices to this degree and compare them to people eating more standard diets, not as healthy, you're going to see a tremendous difference in these parameters that can predict your future health. Because we don't want to just wait till people to have to prove this after they live for 40 or 50 more years till they die and see who lives the longest. But the whole foundation of a Nutritarian diet is based on all those long-term studies that did follow groups of people for 20, 30 years until just look at hard endpoints. The word hard endpoint means like a cardiovascular death, a cancer death, or an ultimate end-of-life occurrence. So we can look at large numbers of people and say, yes, as we modulate the protein in their diet, we can have them live longer, because we have these studies show that the longest lived people are people who eat more plant protein versus eat more animal protein. So we're saying that eat more animal protein makes for a shorter lifespan, eating more higher plant protein foods make for a longer lifespan. And so that's just one example. You're taking your oils, taking your fat content away from animal fats and oils, and moving more fat content to nuts and seeds. The whole food makes people live longer and reduces heart attack risk. So when we put together a dietary portfolio that includes all these factors that are associated with longevity, now we can say, okay, for people, let's see what kind of extra lifespan benefits and anti-cancer benefits we can get here. And as you know, this whole new growth of technology enabling people really to pinpoint where they are and to prove what they're doing is working for them is just magnificent.
Yeah, absolutely. And you're doing something very unique. There's not a study out there like that yet, which is why I'm, again, so excited about yours. We do see a couple other studies in the nutritional-based field, with the DASH diet, the dietary approaches to stop hypertension, and then we also see more of a nutritional component with Dr. Kara Fitzgerald study as well. So all in all, we should absolutely hypothesize that we would be able to see a reversal in a lot of the biological aging metrics. So I'm really excited when we have those results, and we'll be able to do a deep, bioinformatics analysis dive. But almost getting ready to wrap up our Q&A here. Where can people learn more about this diet? Where can they go? What's their best resource?
Well, my website is drfuhrman.com, drfuhrman.com. And my most recent book, I've written 12 books, but my
Wow.
I have 7 New York Times bestsellers, but I actually have 5 that are not the New York Times bestsellers. And then my most recent book, with the most recent updated research, is called Eat for Life, for those people who want to read the most recent book. And it's funny, is one of the studies on the Nutritarian diet, the DASH diet, for example, was considered by like Newsweek or news publications to be the most effective at lowering blood pressure because it lowered systolic blood pressure 11 points. But a Nutritarian diet on 450 people, and by the way, the DASH diet where they lowered it 11 points, the medications were held stable. On the Nutritarian diet, we dropped the systolic blood pressure 26 points, not 11 points. 450 people averaging 26 points, but the medications had to be removed. So if the medications were kept stable, it would have been much more than 26 points, but we couldn't keep them on the medications because the blood pressure became always normalized. It got got favorably low. So it's not even comparable to the efficacy here, just in regard to reversing.
Absolutely. We should see really great results. And then, Dr. Fuhrman, where are you at in the study? When can we expect some excited results? Can you tell us where you're at?
Yes. Well, we've got all the women in the intervention group who've followed the diet long enough now, where we're doing the testing on them. But now we're still talking about the control group of getting at least 50 women who aren't eating the healthy diet. So I've got all the women who signed up, because we had 2,000 women that signed up originally for the Nutritarian Women's Health Study, and we've got enough women for that. But now we got to find some regular people eating standard diets so we can compare the differences in the results of the testing that you guys are doing. And so I'm still talking to Dr. Sutliff as to what's the best cohort to use for that. You know what I mean? So once we get that solved, we're ready to go ahead and finish up the study.
Yeah, no, I think everyone listening will be very intrigued and wanting to learn more. So I really appreciate your time, Dr. Fuhrman. I hope you have a great rest of your day.
Oh, thank you. Good luck to you, and thanks for all the great work you're doing, too.